Haley, are you there? Can you lower your camera a little bit, please? Remember, today I want to see your faces and your neck. If you have hands or arms, that's wonderful. Otherwise, it works for me. Okay, Haley, tell me first, can you show me your representation, your bone model representations, fractures representation, please?
I forgot that was today.
Okay. You know that you're gonna get a 0, right? Okay. Let me see who is next. You need to stay there. Okay, go with Maya, you're next.
So I made mine out of clay.
Okay,
And,
good.
so for certain models, like this is my compound model. And this is supposed to represent the skin and the fracture. And then I have my, do you want me to label all of them, or do you just want me to show them
Just
to you?
first, show me the representations, and then we are going to pick one of those and we can talk about it.
So this is my hairline, this is my green stick. I kind of put them on the same thing. And then here is my commutative fracture. And because it is shattered bone, I couldn't really break it into different pieces. So I kind of used clay to texture it. And then right here, I have my transversal fracture. And then I have my oblique fracture is this one. Oh, I'm shaking.
Why?
My
Just
oblique.
relax.
And yeah. Oh, and this is my spiral fracture, which because of the dry clay ended up splitting, but
Okay, that's okay with displacement as well. Okay, Maya, tell me now, can you tell me all those names that you say, the different types of fractures, but now in Spanish?
mm-hmm. So este se llama fractura de tallo verde, and it's basically like a stem. Like when you break it, it's supposed to represent that. And then fractura comunitiva. I'm shaking. Sorry. My fractura comunitiva es esta.
Con minuta. Fractura con minuta. Instead of con minutiva, es con minuta. Okay, good.
And then fractura capilar is this one, which is your hairline.
Very good. Fractura capilar. Because capilar, what it means in Spanish?
It's like it's a capillary. That's kind of how.
Okay, and what it means in Spanish, capilar?
Pelo, like your.
Very good. Excellent. Pelo, hair. Okay, excellent.
And then this is fractura obliqua.
Obliqua. Very good.
Yeah. Luego fractura espiral is this one, which is the spiral one.
Excellent.
And yeah, and then I have fractura transversal, which is your transversal, which is your transversal fracture. Where is it? Yeah, your transversal fracture.
Okay.
And then fractura. Oh, you want me to? Is that fine or?
I'm gonna stop you there. Imagine I'm a patient, okay, that I show up into the emergency room, and you can see my ulna, okay, my ulna that is coming out through my skin, and I have that bone coming out there. Okay, the ulna, just a fragment of the ulna is out of my skin. It just break my skin up, tear my skin up, but I don't speak any English at all.
So one of the
What you
first
can
things
tell me?
La primera cosa que te voy a preguntar es cómo agarraste la fractura y si estás sintiendo otros síntomas como si estás sintiendo vómito o como náusea o si te estás mareando, más para confirmar con quién te tengo que llevar o si te ha hablado contigo una enfermera antes de eso. Luego te voy a preguntar a qué hora pasó de todo eso, si te esperaste un tiempo, y también te voy a preguntar si estabas haciendo un tipo de deporte cuando esto pasó, como yo lo estoy pensando, es si estabas afuera y te caíste en el piso, eres más es más probable que puedas agarrar una infección si te caes al piso y tienes tierra alrededor de donde te abriste. Y también como algo que es muy común es que hay muchas fracturas que son por causa de abuso. Entonces te voy a preguntar si estás en una posición donde me puedes decir cómo la agarraste, o si no estás en una posición, si tienes a alguien más contigo. Y de ahí te voy a preguntar si le has puesto mucha fuerza, si cargaste algo. Luego de ahí te puedo mandar con um, otra enfermera o con un cirujano si es de emergencia.
Okay, very good. Let me see. I'm so scared. I'm gonna start crying. First of all, because it's very painful. Okay, it's very painful, and also I'm seeing my bone coming through my skin, right? And that's very unusual. That's something I'm not expecting to happen to me. And I'm gonna tell you this. Oh, doctora, dígame si me van a tener que operar.
Por ahorita va a ser una posibilidad que te vamos a tener que operar, pero ahorita lo que vamos a ver es si tú estás bien. Entonces, lo que yo haría que tú no estés viendo dónde está el hueso, por si eso te está causando más miedo. Entonces, te trataría de como hacer otra cosa y hablar contigo mientras a lo mejor alguien está viendo dónde está tu herida.
Okay, very good. Tell me, some of the pathological fractures, right? Especially the comminute ones or other type of fractures, simple one as well. Sometimes they happen because there are pathological processes happening in that person. Make
Like
sense?
osteoporosis.
Very good, like osteoporosis, for example. Can you
Osteoporosis.
yes, osteoporosis, and in Spanish osteoporosis as well. Very good. Can you dissect the word osteoporosis and tell me if there is a root, there is a prefix, a suffix?
Osteo means bone, and porosis, or yeah, is
Porosis,
pore.
yeah. Porosis in English, yeah.
Yeah, and it's pores, and together it's a illness that causes your bones to basically hollow out, kind of, and become more brittle and more
Excellent.
to be. Yeah.
Very good. You did an excellent presentation. Thank you.
Mhm.
Okay, let me see who else is coming next. Okay. Catherine, you have your bone fractures representation? Okay, Catherine, you know what are the consequences, right? David. Yoo-hoo, David. Show me all that power, David.
No. Oh boy.
Oh boy, yeah.
Oh boy. Okay. So I did add tape. Yay. So this is my segmented fracture, and I drew lines where the fractures would be.
And you put tape on it? That means if you
Yes,
peel
yeah.
off that tape, that particular piece is going to fall off?
Yeah.
Okay.
This is the transverse fracture.
Very good.
This is my avulsion, and I taped that piece on there.
Excellent.
And this is the comminuted fracture, and I kind of demonstrated with the drawing the different fractures.
Okay, the
On
tiny
it.
pieces. Okay. Very good.
And then the green stick, I wasn't able to correct that. The crown was too brittle to make a smaller piece. So it's just
Okay.
the same.
Okay, David, now tell me all the name of the fractures that you mentioned in Spanish, please.
So avulsion pretty much be the same, avulsion.
Very good.
And comminuted would be comminuta.
Excellent.
Transverse would be transverso.
O transversal.
And the segmented would be segmentario.
Very
And
good.
then
O
the green
segmental.
stick fracture would be fracturo de tallo verde.
Very good. Very good. It's like a rama o vara verde, okay? Rama o vara verde. Es como cuando agarran una rama de sauce, uh, willow tree, for example. You grab a branch of the willow tree and you bend it. It's not going to break. Make sense? You can bend it, but it doesn't break. Okay, go with the comminuted one.
Comminuted.
Yep.
Okay. So one cause. Well, okay. So the root word is minuere, and the prefix is com, or in Spanish it would be con, meaning
Very
with.
good.
And like a pathological cause is osteoporosis, and it's the same in Spanish. And the root is osteo, and then the suffix is porosis.
All the suffix is porosis, or you have two suffixes there?
There's two. I'm
Very
sorry.
good.
There's pro, meaning porous, and then osis, meaning like the cause of.
Okay, or pertaining to. Okay, very good. Tell me, imagine there is a, what is the, tell me in Spanish, imagine I have that particular fracture. I'm your patient. You are my traumatologist or my surgeon. And you are the first person who is in contact with me and you diagnose my comminuted fracture. Tell me in Spanish, because unfortunately I cannot speak any English. Can you tell me what are the worst case scenario for me as a patient? Why you are concerned about my fracture, my community fracture? Why you are concerned about it?
Um,
What can happen to me?
uh, tienes muchos huesos y tienes, uh, hay una posibilidad si tiene un problema en su corazón o tu sangre.
Okay, not bad. You are saying that that patient, maybe those tiny little fractures or even the bone marrow of that bone can travel through the bloodstream, right? Using the bloodstream and impact in that person's heart, especially the coronary arteries, or even in the lungs. That means that person, it could be at risk, a very serious risk of die. Okay, that's the reason you will need urgently to do the surgery and fix it, right? And how we fix it, David? Imagine you try to explain me how you are planning to fix that dangerous fracture that I have.
Necesitamos realizar una cirugía.
Cirugía, very good. ¿Y qué va a pasar en esa
Y
cirugía, doctor? ¿Qué me van a hacer en la cirugía? Tengo niños.
um, tenemos programas y puedo
Okay,
ayúdate.
okay, don't overthink. Just tell me, describe me, or tell me at least in the very basics how you're planning to fix that problem. What you're gonna do with those tiny pieces of bones, how you're gonna hold them together.
Do you want it in Spanish?
Do it in English first, and then we are gonna try in Spanish.
Okay. So we're going to take a piece of bone and hopefully take the larger pieces and put them together with glue or some other form to put them together.
Okay, not bad, not bad. Okay, thank you, David.
Thank you.
Let me go now. Who is next? Anne, you're next. and where are you? Oh, what happened with that? He was there. Okay, maybe something happened to his internet connection or something like that. Okay, let me see who's coming next. John is absent. And Anne is not here. Claudia, you're next. Claudia, are you there? Nope. I think some people chicken out. Henry.
My turn?
Henry? Yeah, Henry.
Yes.
Okay, show me your bone fracture representations, please.
Got it. Okay. Let me first get my spiral run. I used sticks I found in my backyard, and then
Okay,
I kind of
perfect.
and then I either chipped at them or like try to get them or they were already naturally kind of in the natural shape. So my first one is kind of the spiral. It's kind of turn around right here. You can kind of see it has the spiral motion around the stick right here.
Okay, can you put it
see
closer?
the kind of spiral motion around it, kind of having the twist
Okay.
from the. Okay.
Okay, good.
Next one would be the vertebrae, or the osteoporotic fracture. And then this one is kind of like right here, as you can see, like if the vertebrae would come in, and then if like a collision would happen right here, allowing the compression on the stick, affecting the whole vertebrae.
Okay, good. By compression, excellent.
Okay, next one, let me see which one is. I believe this is my close one actually. No, it's actually my, let's see here. This is actually my oblique fracture. So from the angle from the downward angle coming from this way. So like if you had like a hit from the angle or the side, it would come down this way. And also you could also say it's also a simple fracture because it is broken into two. So there's no other parts.
There's no displacement. Okay, Henry, don't describe all the fractures. Just show me and classify them. Then I'm gonna pick one, and that one is what you're gonna be talking about.
Got it. And then my last one would be the commuted.
Community?
Yes. And basically all the kind of parts are in the tape. But so if it was in a bunch of mini pieces, which the mini pieces would be in the splinter like break right here.
Okay, good. Okay, Henry, now tell me the names of the fractures in Spanish, please.
Fractura de espiral, fractura comunita. I think the last one is fractura osteoporotica and fractura obliqua.
Fractura obliqua. Okay, very good. I want you to explain me what are the best case scenarios, well, not the best case scenarios, what are the case scenarios that is likely to happen a oblique fracture, fractura obliqua. Pick that one, show it again, and then talk about that particular fracture.
Got it. Here it is. I'm gonna make sure I have to get the right one. Okay, got it. Here you go. Okay, so with the obliqua fracture, it is more it's also what you call a diagonal fracture in a way because it comes more from a diagonal angle at a certain angle, which means the hit or the collision from what you have interacted with came at the opposite angle of the bone, which would have caused it to basically kind of go in that diagonal shape. And so basically you could either in this and others also could happen in multiple ways. It also could interact with other different fractures such as commuted depending on the severity of the collision. But in this case, I have a non-displaced one. So in this case, you would have to put a splint together, also depending on the severity. We're also including surgery of adding certain, nails or wires to hold that together to make sure that the bone heals around that angle fracture and make sure it holds together. Again, also on time-wise, depending on how much it heals, it could take up to months to actually fully get that. And then also therapy, depending on the, of course, severity, as and it usually occurs most likely in the, I think it was the arm, I think, or was the arm or leg, mainly limbs though. It's mainly the limbs, depending on where you came from. And most of these fractures do come mainly in vehicular collisions because of the fact that bones are so dense that you need a big impact to break these. And then you also, for this one, you also need to be at an angle for that to come at the opposite
Okay.
angle of the.
Let me stop you there. You're doing a very good job. Now, I'm your patient. I don't speak any English at all. And you need to try, in very simple words, tell me what's going on with me. And there is nobody else in that area of the hospital who is able to help you with Spanish.
So
But you're gonna do your best.
So use Spanglish, basically.
Well, hopefully it's not Spanglish, but do your best.
Got it. So, tienes una fractura de obliqua, like angle of
diagonal,
diagonal de bone. We are going to use splinters to use your bones to, should I put this?
How you say bone in Spanish? How you say bone in Spanish?
Isn't it like no?
That's in Latin.
Latin. Why do you use Latin terms?
Oh, hueso, huesos.
Hueso. So we're going to put together and
juntos.
And like
huesos juntos.
Oh, huesos juntos.
Very good. Y para hacer eso, to do that, you need to do what with me? Where are you gonna take me?
To the isn't it like called the OR?
Yes.
No.
Very good. The OR. Yeah, the OR, the operating room. Can you say that in Spanish? Because I don't know what it means, operating room.
It's in here.
Sala.
Otro de sala de no.
Sala de
cirugía. De cirugía.
Cirugía, surgical room, okay? Okay, surgical room. Okay, it's a cirugía. Very good. And I'm asking you as my doctor, what are the chances I have to get my broken bone absolutely fully functional after the surgery? What are you gonna tell me?
Well, it will also depend on the severity of the collision. So if it's considering
No. Just forget about that. You are not going to explain all the stuff to the patient. Make sense? Because the patient gets more confused. You need to give simple answers, and the most common thing that happened after the surgery. And try to use your Spanish or your Spanglish or whatever. After the surgery, doctor, I'm going to recover all my arm functionality because I need to work. I have many mouths to feed.
Okay, so necesita una terapia física.
Very good.
Y rest. What's rest?
And tell me how long it's gonna take me at least to get back to work. What's the most best case scenario? How many months in the best case scenario? At least how many months?
3 y 4.
Okay, with physiotherapy, yes. The bones are going to heal in 2 months probably. Okay, but yes, physical therapy and all the stuff, it requires a little bit longer. Okay, very good. That means how you say 3-4 months. How you say that?
3 y 4 meses.
Excellent. Excellent. Very good. Very good. You did a wonderful job. Let me tell you guys, I'm very happy so far. Okay. Connor, your next one.
For my bones, can you see it?
Yes, perfectly.
Okay, this is my spiral. The crack is right through there.
Okay, show me the front and the back of the bone, please.
Oh,
Well, the representation of the bone, obviously.
I don't know if you can see it or not.
Yes, I can see it perfectly. Just
Oh.
turn around and show me, yeah, front and back. Okay, much better. Yep.
This is the green stick.
Excellent.
This is the closed. And
And what type of fracture as well is that one?
the other one or this one?
This one.
Oh, this is closed.
And what else? It's close, and what else? It's just what? Is perpendicular to the shaft. It's perpendicular to the diaphysis. What's the name for that particular fracture as well?
Transversal.
Yes, transversal, or transverse. Yeah, very good.
And my last one is open.
Okay,
That's the back.
okay. Let me ask
That's
you
all.
this. Let me stop you there. What is one of the things that you missed during your project, doing these particular type of fractures, in order to represent in the best way how the bones work during the fracture? What is the thing missing in that representation? For example, the ones you have the two pieces separated. That happen for real in a patient? It could,
No.
but still the bones are not gonna be like floating or separated everywhere, right?
Yeah,
Who
I
is
should have taken them.
very good? You should have, or you can use even like film, paper film, the one you use to wrap in your kitchen, for example, food or a container, something like that. Yeah,
Yeah.
because that represents what? All that paper film, all the tape represents what around the bone? What is around the bone that is keeping the bones together or close to each other, those fragments? What is around the bones? Imagine it's your leg or your arm.
Tissue and muscles.
Very good. You have the muscles, you have, for example, adipose tissue, that means the connective tissues, and then you have the skin, right? Then you have the skin. That's the reason when you have a exposure fracture is when the bone goes through your skin and it goes outside your skin. Okay, very good. Okay, show me the transverse one. Very good. Excellent. Okay, now tell me, first in English, what are the most common case scenarios where we can get a transversal or transverse fracture?
Can you repeat that again?
What is the most common scenarios that we can get a transversal or transverse fracture? In what
Like how
case?
it happen?
Yes.
Oh, falling on your leg or impact
Okay.
can cause
Can you give me a particular specific example?
well, one could be jumping from like a really tall like platform, and another one could be skateboarding and you fall on your leg.
I prefer that one because if you're jumping from, I don't know, a high altitude or just a tall something, and you jump off that, probably what else is going to happen? Yes, you can have those bones breaking transversally, but also what else is going to happen with the pieces of the bone? They're going to what?
Shatter.
Well, they're going to start in different pieces. That it could be a comminuted one, but let me put this case scenario. Imagine you are the coroner, okay? and you are called by the police that we have a body and we don't know at that particular place, and we need to know immediately is that is a criminal case or it was a person who tried to kill and succeed killing him or herself. You go to that place, and let me tell you, even the most inexperienced coroner, just a regular doctor can diagnose this, determine this. What happened if the person, for example, jump off the building and somebody pushed that person? That means it's a criminal act. What happened? How you, as a coroner or as a doctor, you're going to know at the right moment you go to the crime scene if that person jump off by himself or herself or somebody push it? How do you know that? What's going to happen with the person when he's falling? What's going to happen with the hands?
They would most likely fall like face forward
Very
and
good, because the person is trying to what?
brace themselves.
Exactly, try to defend, okay? It's a defensive reaction. And obviously the bones in your wrist are going to smash and they're going to come all together, okay? They're coming one into the other one. You have a comminuted fracture at a time, and also you have an impacted fracture, okay? Very bad. And that is a criminal case, or that's a person who commits suicide? What do you think? You have the defensive reaction falling.
Criminal.
Very good. Because the person was pushed and you don't
Yeah.
want to die. Make sense? That's the reason you are going to fall just with your hands, defend, protecting yourself. In the other case, you're going to have these particular fractures in the wrist and the hands?
No.
No, no. Okay, the person is not going to show any sign of defensive. Okay, makes sense? And you have the impacted fracture, okay? The impacted fracture. Okay, very good. Now tell me the names that you mentioned in Spanish, please.
The spiral is fractura de espinal.
Espiral, fractura espiral.
Yeah. And the open fracture is fractura abierta.
Very good.
The open, oh, I just did that one. The green stick is fractura de palo verde.
Palo verde, en palo verde, yeah, o en vara verde.
And the closed one is fractura cerrada.
Okay, very good. Now, this is the case scenario, Connor. You are in the emergency room and you are the first attendant, and you have a person who doesn't speak any English at all, and you need to help that person to understand what's going on, okay? And you are able just to diagnose with a simple maneuver, okay? Just pulping. You're gonna see my wrist very swollen at that moment, and maybe there is a hematoma growing there. And okay, what you're gonna tell me in Spanish to let me understand what's going on with my left wrist.
Doesn't matter which bone fracture.
Doesn't matter because you don't know yet. You are going to diagnose that with an X-ray. Make sense? Just tell me what's going on with me. Let me understand in Spanish. Use the most simple words that you can find in Spanish, because as you know, any other person who doesn't speak more than one language, if you use simple words, simple cues, that person is going to understand what's going on.
Okay, I'm not really good at Spanish, but I would say
Don't worry.
tu mano
Very good.
is, I don't know how to say broken.
Quebrada.
Quebrada.
Very good. Tu mano está quebrada. Very good. En este caso es la muñeca, the wrist, ¿ok? But it's okay, la muñeca. La muñeca está quebrada. Very good. Now tell me in very simple words, what's going to happen with me next? What are you going to do next to confirm your diagnosis? To confirm your diagnosis, what are you going to do with me? You're going to take me where?
To get an X-ray.
Very good. Can you say in Spanish what it means X-rays?
I just saw this too. Um,
X is very simple in Spanish. It's the letter X. How you say the letter X in Spanish?
Y, I don't know.
X. X.
X, yeah.
And rays in Spanish is
Rayos.
rayos or rayos. It depends what Spanish you are talking, okay, speaking. Rayos or rayos. Rayos X. You're going to take me to the rayos X or the rayos X, okay? To confirm, para confirmar tu diagnóstico, okay?
Mhm.
Okay, good. Okay, next one. Let me... Nicholas.
All right, before I begin, full disclaimer, not all fractures are exactly the same, and they're most definitely not as clean as depicted here. But
Okay.
just to quickly begin, we have our first fracture. This would be a very nasty green stick. As you can see, there is a present fracture. However, it is not completely, it is not a complete fracture.
Okay.
And, yeah, it does bend. And right next to that, if I can find where the end of the tape is, unfortunately, it appears to have attached. We have an, oh, I completely skipped over something. The green stick fracture in español is un fractura de tallo verde.
Very good.
Next, we have a oblique fracture, also known as a fractura obliqua.
Okay.
Where they are, in its name, the fracture is oblique to the shaft of the radius of the bone.
To the axis of the bone.
Yeah, my bad. The axis of the bone. Next, we have our transversal.
Or
I can get this
transverse.
off.
Both are correct.
A transverse. As you can see, it is directly perpendicular or transverse to the my brain doesn't want to work.
The main.
Yeah, the breaks directly across the long axis of the bone.
Very good.
Also known as una fractura transversal.
Very good.
Next, we have a spiral fracture. This one took some time. I had to hold it all together.
But let me tell you, I'm super happy that many of you use just common regular things you can find in your backyard, you know, your among your pencils or crayons, simple things. Very good.
Una fractura in espiral, very similar, if to the unaided eye, to a transverse fracture.
Or
Sorry, not
oblique.
transverse, oblique, my bad. That's why usually it requires more than one radiography to tell, but this is usually caused by a twisting force of the bone.
Very good.
Next up, we have a very nasty commutative fracture, also known as una fractura
Comminuta.
comminuta. Gracias. I am not going to take off all the tape at risk of sending all of these poor little bone fragments, which was part of this proximal fragments, all over the place. But as you can see, there are multiple fractures, more than two, because if there's two, it's another type of fracture in which I do not remember its name.
Don't worry.
Next, we have a avulsion fragment, or
Avulsion. Yeah. Very good.
which is basically a fracture of the articular surface, in this case, this is a representation of it, is usually pulled off by a ligament or tendon. And then finally, we have the very hard to detect hairline fracture. You likely will not be able to see this, but very slightly, there is a line across the diameter of the bone. This is also known as un fractura capillar, and as said before by one of my colleagues, it comes from the base of meaning hair.
In Spanish?
Fractura capillar.
Okay, and how you say capillar in Spanish?
Pelo.
Pelo, very good. Pelo. Okay, excellent. I want you to talk about a little bit about the hairline fracture.
Okay.
O fractura capilar.
La fractura capillar or hairline fracture is a tiny crack within the bone itself, usually found in areas of high stress or load, especially in the foot or leg, because that is usually where the majority of the body weight is placed. However, it can be found everywhere, like all bone fractures. It is highly circumstantial. More likely in those with a pathogenic disease that could cause degeneration. These are found more within athletes and runners, people who use their legs a lot. They are usually hardest to diagnose due to difficulty of detection on X-ray. However, they still exhibit bruising, swelling, and tenderness, which can be found through a physical examination. Fortunately for the patient and for the doctors and the radiographers, MRI scanning acts as a more conclusive test. Hairline fractures are treated with the uses of crutches, especially when in the foot, or other means of relieving pressure. Sometimes, however, if the fracture is worse, a cast is applied or a kind of boot to prevent the risk of the fracture becoming aggravated.
Okay, excellent. Let me ask you one simple question, and then I'm gonna acting out like a Hispanic patient. Tell me this: in a hairline fracture or fractura capillar, there is a chance that, for example, I'm not a sportman, I'm not doing an excessive physical activity or force. I'm not that old that maybe, or I don't have a precondition that is exposing my bones to a pathological fracture. But I'm under a lot of stress, working in a school and handling all these students, and especially nowadays with the coronavirus and all that stuff, my emotions are very unstable.
Unfortunately, you are not prone to a stress fracture. By stress, they mean by forces, weight, not emotional distress. In that case, you need a psychiatrist.
Well, let me tell you, my psychiatrist told me that yes, my emotional state started contracting my muscles and my tendons were pushing too hard my periosteum. Is that possible?
I'm going to argue it's based on localization, and it might be more of a matter of having como se dice, an avulsion due to the greater stress placed upon the articular surface. However, with that new knowledge, I'm still going to say no.
Well, let me argue with you this.
Okay.
There is a chance, Okay,
There is
there
a
is a
chance.
chance.
Oh.
Yes, there is a chance. And that is one of the things that you need to take care when you are, for example, in the front line, in the emergency room, or you are in your, your resident years or something like that. Usually doctors are having this perception that if you have a hairline fracture, it happened because all the things you said, and you are perfectly right. But there is a chance that you have, for example, a very young college student. And that college student is just like a student like many of you who are outstanding students who try to be on track all the time, and you want to graduate on time and all the stuff. And also with being probably one of the top 5% of your class.
Mhm.
That is going to generate a lot of stress and emotional distress.
Fair.
Reason why sometimes, yes, you are not going to be, there are conditions, preconditions, they are going to help that. For example, you're not have a good alimentation probably, you're not going to have a good sleep time as well, blah, blah, blah. All those things can literally weaken your bones, and the tendons, because you're going to be contracturate, they can pull the periosteum and you can have a hairline fracture. Yes, that can happen. And that's essentially because emotional distress. That person is not doing anything else except just thinking, 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 thinking.
So it's an amalgamation of causes that have a base in stress.
Yes, yes,
Okay,
exactly.
that makes much more sense.
Yeah. Okay, now I'm your Hispanic patient. I'm a very young college student. My name is Nicholas, and I'm under a lot of stress because I had 2 tests, 1 project due next week. And I want to graduate on time, all the stuff, blah, 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 blah. And go to the emergency room because I have a very painful pain, by the way, redundancy, in my radius.
Radius.
Okay. And unfortunately, I'm from Mexico, Guatemala, Central America, and I just moved here because I have a scholarship. My English is really, really bad, and I need your help in Spanish, doctor.
Oh, señor, desafortunadamente, tú tienes una fractura de tu hueso. Es una fractura capilar.
¿Y qué vamos a hacer, doctor?
¿Repite?
¿Qué vamos a hacer? ¿Qué va a hacer conmigo?
Okay. Últimamente, tú tú no necesitas cirugía, tú necesitas una, ¿cómo se dice? Un yeso.
Very good.
Necesitas más descanso.
Muy bien. Very good.
Yo entiendo que tienes un examen por tú no puedes a tomar el examen si ¿cómo se dice? Si no puedes usar tu muñeca.
Okay. Very good.
Mano.
Very good. And do you think my alimentation is also a problem, maybe?
Yes.
Yes.
In this case, since they're a student, there's a likelihood that they're having an increased usage of their hands and wrists. Therefore, extensive writing, typing, etc., can lead to more usage of the bone and stress, alongside with the environmental factors, can cause a greater likelihood of having a hairline fracture.
Okay, and because I was an IELTS student for 5 years, uh, are you going to recommend me to stop drinking? Because you have this college party, you know, and what do you think, doctor? IELTS students are going to be drinking when they leave IELTS?
You shouldn't be drinking outright,
Very
but
good. ¿Cómo
getting,
dices, no deberías tomar? I'm sorry, ¿cómo dices, you shouldn't drink?
tú necesitas no beber más, ¿cómo se dice alcohol?
Alcohol o bebidas
Alcohol,
alcohólicas. Ujú.
alcohólicas, porque es muy mal por tu uh, higiene y how do you say make you more likely?
What is the word?
How do you
Más
say
probable, más probable.
y más probable por una fractura de tu hueso.
Muy bien. Very good. Excellent job. Okay. Let me go grade this guy here. Okay. Okay, guys. Let me tell you, I'm very proud of you, all of you who presented. Let me tell you, did a wonderful job. I'm proud of you because literally, if this was a real case scenario and you are your first year as an intern or as a medical student or as a nurse, you know, just having your practice, you are able to connect with the patient. You're going to be able to explain that person what's going on. And don't be afraid, okay? Don't be afraid to speak loud and clear. Don't worry about if you are messing up a little bit with the words and all the stuff. Make sense? Because literally that person is going to really appreciate your effort and that you are trying to communicate in that person's language. One of the harder things usually to happen in many, many places. And the translator, even you have a translator, like many hospitals or all the hospitals have access to, is not the same. The person wants to see you. They want you to speak as possible in their own language, even when it's not the perfect. Don't worry, okay? Try to make that emotional connection with your patients. They need it. They need you, okay? Okay, guys, excellent job. And because you know you did that excellent job, you are free to go. Um, and hopefully we're gonna keep improving all this stuff. But you did a wonderful job. Thank you, everyone. Have a wonderful, restful, nice, long weekend. You did a wonderful job. Thank you, Mr. Miller, for being there and just contemplating the wonderful job you did.
May I just compliment all these future doctors and nurses? And
Absolutely.
I'll ask you to study very, very hard because I'm getting old and I'm falling apart. So I'm going to need you.
And they're going to be there for us. Let me tell you, we are going to see some of these faces maybe in the future. I'm going to be surprised how far they went. Okay, guys, have a wonderful, restful afternoon and long weekend. Bye-bye.
Ciao.
Ciao, ciao.